Don't smoke in the house, at home, never have done around the children. But my youngest, he suffers with, he had pneumonia and things last year and really bad asthma and was in and out of hospital. And I thought, I was getting a lot of feedback from the specialists at the hospital. What can we do, you know, to prevent this from happening again? What can we do at home to help with his allergies and his asthma? And one of the things that kept coming up all the time was the smoking. And the particles you carry on, you know, because I always thought, well, I don't smoke in the house, I don't smoke around the children, you know, I'm not having an impact on them, without realising that the particles you're carrying on your clothes does have an impact on them, whether, you know, and I was sort of oblivious to that. And then once I got all the information from them and kept getting the feedback, I thought, oh, hang on a minute, alarm bells were going off, and I was thinking, it wouldn't just benefit me, it's obviously going to benefit them. So just trying to distract yourself really when the craving comes on. And I think trying to break habits, because when you've been smoking day in, day out for, you know, a long, long time, it becomes part of your everyday life. You reward yourself with a cigarette. If it's a stressful day, a cigarette calms you down. If you're on, you know, you're on the phone with your friends, you know, you're going to be on a long time having a chat, have a cigarette, or your coffee. So it was trying to break the things that link you with the cigarettes, trying to change your habits, your daily habits really, your routine, and also things to do with your hands. You know, they suggested taking up knitting. My husband wasn't very keen on that idea. The help that the service gave you was there was knowing there was somebody there. And you had weekly meetings as well. That's a really good incentive. And when they measure in your carbon monoxide, is it when you know you're blowing into the puffer and you get a low reading, that really boosts your confidence and thinking, yeah, you know, that's another week. You know, and I'm classed now as a non-smoker. My reading's down there, you know, really low. But for us, I mean, my father-in-law passed away during the time that we'd stopped smoking, and that was really difficult. I mean, obviously I think more so for my husband, but it was a really difficult time. And if it was going to break down, you think, oh, you know, you feel quite vulnerable at that time. But then you've still got the service there to back you up. You can ring them and say, oh, this has happened, and it's sort of they advise you to get a support network in place to let your friends and relatives know that you're quitting smoking, and to tell them, you know, that I might ring you if I need support, or to, you know, keep cheering me on. The health reasons, the health benefits, getting up and down stairs, running. If you've got younger children, the day-to-day hustle and bustle, you know, rough and tumble with them. You don't get out of breath. You're not red in the face. You're not, you know, you might perform better at parents' sports day and things like. But it just every day you just feel better. Your skin looks better. Your hair, your nails. You don't smell anymore. You know, when you're a smoker, you don't realise that you smell because you can't smell it yourself. But when you stop and then you come into contact with other smokers, you realise then, you know, it's not very nice. So yeah, I think the benefits there's across the board, and it's not as socially acceptable nowadays, is it? You know, in the 50s, all the movie stars smoked on screen, didn't they? It became fashionable to see people in the movies with a cigarette. That now, I think there's more education out there, definitely. People are more clued up with themselves and their health, and you know what is bad for you, what's good for you, and you know, I think there's definitely more education, and it's easily accessible to just send an email to the quit service and ask for help, and to get the response, you know, and they take it from there. They guide you all the way through. There's nothing really you have to do it apart from stop smoking, you know. The financial benefits from quitting, me and my husband worked out what we were smoking a week, and we worked out the cost. So we got ourselves a little tin, not a money box that you can open, a tin that you have to literally cut open to get the money out. They sell them in all the card shops and things, you know, most general stores now. We bought one of those, and we've started putting in not the full amount that we would have been spending on cigarettes. We still have a little bit left so that we can have a little treat a week, you know, if it's takeaway or a bottle of wine or a trip to the cinema with the kids, something like that. But we put the majority of it in the tin every week. So when we're going to open that tin, I'm not too sure. My husband's after a shed. I can think of better ways to spend the money. But yeah, up to now we've carried on, you know, putting our money in the tin each week, and we haven't got a clue. We have a guess how much we think we've got in there. But yeah, that would be nice to open that, I think, maybe near Christmas, and have a night out, or, you know, a new outfit or something would be, yeah, and see how much is left towards this shed. Even to contact the service, just go along to the first meeting. Contact the service, tell them you're thinking, you know, I just sent an email and got feedback, and it was easy as that. They sent you a number, you ring them up, they make an appointment, and it'll always be local to where you live, so there's no great hardship. You haven't got to travel far to get there. A time that's convenient for you, a day that's convenient for you, go along. You know, even if you're not sure but you're thinking about it, just go along, get some feedback, see what's there, and take it from there. I mean, it does work. You just got to try it.